Brian Schiff is the co-founder and CEO of Flip, an Xperity technology partner specializing in voice AI designed to enhance the patient experience. Under his leadership, Flip has grown to handle over 20 million calls per week, providing businesses with tools to automate customer interactions and improve service efficiency. Welcome to DX the podcast, Brian.
It is an honor to be here.
Awesome. Well, so much going on with Flip, but one of the things that I find most interesting is your perspective on voice AI, that it's not just automation, but you consider it a true channel strategy, right? So human intelligence connected with like the urgent care business strategy, and how do we kind of, work through that as urgent care leaders when we think about voice AI as a channel strategy, right? So deep diving into calls, et cetera. Tell me more about that.
Yeah, I think that the phone has always been a big part of how business gets done in healthcare, whether it is the front facing, right, the experience with the patient, but also when you think about, right, the internal operations, when you think about the workflows associated with things like medical records, right, it's communication between all these different departments internally, and it is always happening over the phone. So I think the phone has always been there, and it's always sort of been a challenge for people, and like one of the necessary evils
there it is,
of doing this whole thing. And what we think about is, hey, how can we introduce an automation layer, an AI layer that is going to have all of the intelligence that the people have, both in terms of how to communicate, but then also having access to the systems, right? So one of the reasons why we're so excited about the partnership with Xperity is the way in which we can use all of the data that is in the EMR, the way in which we can integrate with Clockwise, and when somebody, right, when a patient calls in and, right, maybe they're calling in and it's a Monday morning after, there was a lot going on in town that weekend, and maybe the waiting room is full and they're sitting on hold and they're just trying to, get some information. Maybe they're trying to get an appointment booked in for that afternoon. Being able to answer the phone, help them, get them the information that they need, get them on the schedule, whether it's 9 a.m., whether it's 9 p.m., and there's nobody there. So I think the phone's always been a big part of it. And when you can make it something that runs really well, then it goes from being this, pain in the behind to something that's, really driving value.
So how do you kind of envision that you would differentiate yourselves, right? Like, this is one of your biggest kind of thought processes, is how do I differentiate from the typical historical, I'll just use the word like bots or robots that we're all like, oh gosh, we can tell if we're ready to click the phone, right? How do you use those connected lines to differentiate? Yeah,
totally. So when you think about when somebody's calling, they have something that they're trying to accomplish. They have like information they're trying to get or a task that they're trying to complete. And I always think about, either the bot on the other end of it is capable of doing the thing that they're calling for and completing it on their behalf, or it's not. And that is really the determiner of, is this helpful or is this in the way?
100%.
If somebody calls and they want to schedule a visit, either the bot can schedule the visit for them or it can't, even if it is the most fun thing to talk to ever. If it can't schedule the visit,
just want to hang out on the phone with the bot.
Yeah, exactly. It's just in the way. So I think that that's a big part of it. And then, we've all talked to those things, and it's like, say yes or no, or press 1 or 2. And when you look at, everybody's talked to like ChatGPT or something like that now, like the level of intelligence that's there in order to just be able to like understand what people are saying in different environments, different languages, different accents, background noise, all of that stuff, right? So being able to incorporate that technology and then make sure it has the integration so that it's able to do things. And then when we really think about, hey, how are we going to turn this into a product that is something that is easy for, your busy urgent care operators, right? They don't have teams of AI experts that are sitting around to like use the, ChatGPT APIs. Like, they can't do that. So what are you doing in order to make this like a full solution that they can pick up and use that's going to work for their business? And
out of the box.
Out of the box. And a lot of it comes down to all of the sort of like design of the experience, and then the workflows that are associated with those common call reasons, and then the integrations that need to exist in order to actually be able to complete those things.
Yeah.
So
tell me more about the common call, because I think that's something that many of our partners are not aware of, right? Our clients that are getting thousands of calls any given week, month, whatever, depending on their size. What kind of work have you all done to help them understand, this is the type of calls you're typically getting, and kind of, diving down deep into that and helping them almost understand their business more by way of partnering with this type of model?
Yeah, I think everybody has intuition around what people are calling about and how often the phones are even being answered at all.
Oh gosh, yeah, that's scary.
So the first step when Flip starts working with a new group is we want to get an understanding of what's happening in all of these calls.
Yeah.
So we will do what we call listen mode. And in listen mode, we help the group set it up so that all of the calls get forwarded to Flip, and then Flip is going to forward those calls back. So the caller doesn't even realize that there's like an extra leg in the journey, but we then have access to the recordings, which allows us to then understand what is the distribution of what these people are calling about, so that we can then sit back down with the customer, and we've got like a nice little template diagram that we drop it into, and it shows over the last week that we've collected 10,000 calls or whatever it is. This is the distribution across the 50 most common call reasons that we see across all of the groups that we work with.
Sure.
And these are the ways in which your data is consistent with what we see. These are some things that are unique to what's going on. And then that in its own right is sort of a valuable asset and a valuable insight.
Yeah.
But then it also doubles as that becomes sort of like the roadmap for like, how are we going to approach this? And are we going to focus on, if you've got super high spikes going on in calls about lab results or about prescriptions and some of these, more clinical oriented things, then like maybe that's really where the pain point is. And that's the place to start, even though, the sexier thing might be the scheduling.
Yeah, exactly.
So it really, it provides that insight up front, and then it provides a joint roadmap that everybody can sit around the table and align on and say, okay, these are the things that we're going to do sort of in this order, and the reason why we're doing it is based on the data that we're looking at together.
Love it, because it's more than just tacking a product on. It's saying, no, let's understand the context, the situation, how is this kind of ecosystem working at your current clinic, and now how can we integrate into that and help you elevate the experience for the patients, which is really cool.
Yeah, rather than just showing up and saying, I've got all the answers, this is what's going to work.
Slam it on the system.
Yeah, it just makes it much more collaborative.
Yeah, for sure. So one of the things that we've talked about in the past is kind of that fine line between understanding the patient's emotions and kind of knowing when to escalate a call versus not. And you even mentioned earlier the kind of chat GPT approach to interacting with these types of agents versus, because now our clients, our customers, our patients are more aware. They've all used ChatGPT. They're like, why is this thing saying press 1 or 2? Aren't you like versed in ChatGPT, right? So now elevating it to that next level, tell me a little bit about escalating versus de-escalating, understanding some of the nuances of a conversation. What work have you all been doing with that?
Yeah, totally. So I think it starts from a couple of like sort of base principles. One of them is if somebody wants to talk to a human, you can maybe try once to be witty and convince them to give
witty.
The AI a shot.
Yeah.
But
try
then
to win them over for just another second.
Yeah, exactly. Just like, give me one more chance. But then you have to let them go on their merry way, and you get them next time. So I think that's one sort of foundational principle. A second foundational principle is we want the control of what are the types of conversations that the AI is going to attempt to handle? What are the types of conversations that it's not going to handle?
Sure,
and when
clearly,
it is trying to handle it, exactly what is sort of like the business process that is going to be followed. We want that to be very sort of black and white and, no ambiguity, no room for hallucination. Like these are explicit decisions that our customers get to make when they're setting up Flip.
Yeah.
So I think that sort of instills trust.
Right.
And then from there, there's the nuances of the conversation. And it's, you can sense right when you're on the phone with somebody and they're exacerbated or, they're frustrated.
Yeah.
And we have these checks built in where, if somebody starts using
certain
some
words,
extracurricular language, we will
You're
identify
able to
that.
check that. Yes,
Yeah,
exactly.
and then help those people to a happier place. In
Yeah,
their day.
yeah. But on the flip side, what's interesting is like the first thing that comes to mind
on
is
the flip side.
Yeah, on the flip side. There we go. The first thing you think is, oh no, does that mean we're just shoving all the upset patients to, our front desk staff? But in reality, there's a lot of those day-to-day questions, conversations that are already being diffused before they would ever even get to the front desk staff by use of this type of technology, which is super important as we think about staffing models and difficulty filling positions, and especially in an urgent care space where it's very high capacity, high speed, right? Lots of stress. And so I love the idea of just being able to kind of de-escalate even that stress on the clinical side, right?
Yeah.
We're talking about the patients on one hand, but then also for the clinical staff as well. So really, really great work that you've been doing. Super grateful for it and the way that it's integrating into this space. What do you see on the horizon for Flip or any of this kind of technology? What do you think
So
is
many
next?
fun things
Yeah,
on the horizon.
yeah.
We think a lot about how can we, right? Of course, how can we automate a lot of these conversations? How can we make it a good patient experience? How can we use it to sort of streamline these critical workflows that are going on in the back end from medical records, which we talked about, or billing related things. But we also think about how can, what are the most important sort of metrics or initiatives that are going on for urgent care operators right now? And how can we, right, and this comes back to like voice as a channel. How can we leverage these conversations, right? Thousands of conversations that are happening with your patients every day to drive outcomes.
Right.
So a very simple example of this is somebody calls in and they have a question about the hours when the clinic is open.
Mm-hmm.
That person is calling in before they've come in for a visit.
Right.
So in sort of marketing terminology, that would be like a hot lead.
Mm-hmm.
And
so leveraging that.
Yeah. So, one approach to this where it's, solely and sort of exclusively focused on the patient experience is like, okay, I'm going to answer their question. I'm going to tell them how late the clinic is open today.
Yeah.
When you go one step further and you say, hey, we're really trying in these conversations to drive visits. On the billing side of the house, we're trying to drive collections. We're not only going to answer the question around how late the clinic is open, but we're also going to say, hey, we have available appointments times at X, Y, and Z, and can I help you go ahead and schedule a visit and show that, you're not just getting people the answers that they need, but you're also helping drive those outcomes that matter to the operators.
Love it. So cool. Well, thank you so much, Brian, for joining us. It was great to have you on DX the podcast.
Thanks so
Look
much for
forward
having
to
me.
seeing you again soon.
Of course.
All right. Thanks. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.